Today, we're diving into a really fascinating but pretty scary medical condition. It's all about what happens when the body's internal plumbing springs a dangerous leak. So just imagine that for a second. There's this crucial fluid superhighway running through your body. What happens when it breaks? And we're not talking about a simple water leak here. This is a fluid so important that losing it can send your entire system into a crisis. Let's get into it.
Okay, so first up, let's talk about the fluid itself. It's a substance called chyle, and some people fittingly call it the body's liquid gold.
The condition we're looking at is called chylothorax, and basically it's what happens when the thoracic duct, which is like the main pipeline of your lymphatic system, gets damaged. When that happens, this precious fluid starts spilling out into the space around your lungs.
So what's actually in this milky-looking stuff? Well, chyle is this incredible cocktail of everything your body needs. We're talking fats for energy, essential proteins, a huge number of lymphocytes, your key immune cells, and all those critical fat-soluble vitamins. It's like the body's all-in-one nutritional smoothie and its own private army, all delivered at once. So losing it? It's not just a leak. It's like losing your fuel, your repair kits, and your border patrol all at the same time.
So how does a leak like this even happen? Well, historically, the main culprits were things you might expect, like tumors pressing on the duct or certain infections. But here's the surprising part. Today, the #1 cause is actually traumatic injury, and specifically something called iatrogenic injury, which, believe it or not, means it was caused by a medical procedure. So the very act of trying to fix something else, like during a complex heart or chest surgery, can accidentally create this brand new, very serious problem.
And that brings us to the consequences, because this isn't just a localized issue in the chest, it's a full-blown, body-wide emergency. The amount of fluid we're talking about is just staggering. The thoracic duct can carry 2 to 4 liters of chyle every single day. That's like losing a massive 2-liter bottle of soda, or even 2 of them, from your core systems every single day.
In the hospital, there's a critical number they look for, 1 liter a day, or 1,000 milliliters. If the leak is losing more than that, it's classified as high intensity. And that's a huge red flag. It's the point where gentler treatments are likely to fail, and you start having serious conversations about surgery, and fast.
And remember, it's not just fluid volume, it's what's in the fluid. A major leak can cause your count of those critical immune cells, the lymphocytes, to just plummet. We're talking a drop below 500 cells per microliter. That effectively guts your immune system, leaving you wide open to all kinds of dangerous infections.
It's really a devastating domino effect. First, you lose all those fats and proteins, leading to rapid, severe malnutrition. Then, you lose the lymphocytes, causing your immune system to collapse. And finally, the massive loss of fluid can send the body into hemodynamic shock, where your blood pressure drops so low that your vital organs just start shutting down. It is a true cascade of system failure.
So, faced with this crisis, how do doctors even begin to solve this milky mystery? Well, it all starts with some really clever detective work.
The first thing they have to do is make absolutely sure it's chylothorax. Because get this, there's another condition called pseudochylothorax that also fills the chest with milky fluid. But it's totally different. It's from a chronic buildup that's full of cholesterol. So how do they tell them apart? A simple lab test. True chyle is just packed with fats called triglycerides. That's the smoking gun. The whole diagnostic process really is like a detective case. You start broad and then narrow it down. Step 1, a simple chest x-ray to see the fluid. Step 2, drain some of that fluid and send it to the lab. If the triglycerides are over 110, boom, case confirmed. But you're not done. Then it's about finding the why and the where. CT scans look for the root cause, like a tumor, and then this amazing tech called MR lymphangiography actually maps out the entire lymphatic system to pinpoint the exact location of the leak.
Okay, so once the leak is identified, the race is on to plug it. And the first line of defense is a really careful, step-by-step approach known as conservative therapy.
It's a very logical, escalating approach. First things first, you put in a chest tube to drain all that fluid out and let the lung expand again. Step 2 is really clever. You essentially starve the leak. Patients are put on a special diet with fats called medium-chain triglycerides, or MCTs. Now, unlike normal fats, MCTs get absorbed straight into the bloodstream, completely bypassing that damaged lymphatic highway. Less traffic on the highway means less fluid comes out of the leak. And finally, they can use medications to slow down chyle production even more.
But, the big question is, does it work? And the answer is, sometimes. The success rate is all over the map, really anywhere from 20 to 80%. And for those really bad, high-intensity leaks, the ones losing over a liter a day, the failure rate is really high. And that's when it's time to call in the surgeons.
Right, so when those initial steps just aren't cutting it, this is where modern medicine gets truly incredible. We're moving to the surgical cutting edge.
Now, back in the day, fixing this meant a thoracotomy, literally cracking the chest open. It was a huge, traumatic surgery with a long, painful recovery. But today, the new gold standard is something called VATS, which stands for Video-Assisted Thoracoscopic Surgery. Instead of one giant incision, surgeons make a few tiny little keyhole cuts. It's minimally invasive, and the recovery is worlds faster.
And the procedure itself, it's like something out of science fiction. The team injects a special fluorescent dye, called ICG, into the patient's feet. This dye gets picked up and travels all the way through the lymphatic system. Then, inside the body, the surgeon uses a special infrared camera. And under that light, the entire thoracic duct and all its branches just glow. A brilliant, eerie green. It lets them see the exact point of the leak with unbelievable precision. And then they can just go in and clip it shut. It's amazing.
And VATS isn't the only tool in the box. For leaks that are in really tricky spots, radiologists can perform an embolization. They thread a tiny little catheter through the body's blood vessels right up to the leak and then plug it from the inside using tiny coils or a kind of medical-grade superglue. And sometimes they'll also do something called a pleurodesis, which helps the lung stick to the inside of the chest wall, basically eliminating the space where fluid could build up in the first place.
But you know what really stands out is that success here isn't about one magic procedure or one-star surgeon. The key takeaway is that the absolute best outcomes happen with a multidisciplinary approach. It's a whole team. Surgeons, radiologists, dietitians, nurses, all of them working together to tailor a plan for that one specific patient.
And that really leaves us with a final thought. These techniques, like making the body's own plumbing glow green to find a leak, are completely changing the game. It just makes you wonder, as medicine gets better and better at solving these huge problems from the inside out, what other conditions that seem impossible to treat today might become routine tomorrow. Thanks for tuning in.